This one is chronic diseases. Chronic diseases treated on an ongoing basis may be coded and reported as many times as the patient receives treatment and care for the condition. Here's a very important note. Chronic diseases and/or conditions are only reported if they have an impact on the care being provided during that visit. All right, so let's look at an example. The patient presents with upper respiratory symptoms for evaluation. The provider noted and documented that the patient has a history of hypertension. The patient is no longer taking medications for hypertension, but it is controlled with dieting and recent weight loss. The patient's diagnosed with URI, upper respiratory infection, and the patient's given antibiotics. Are we going to code the hypertension? You can see the answer on the screen.
Yeah.
You know that you're going to code it, even though he's no longer taking medication for the hypertension. It's still part of the chart that it's a diagnosis, and the way of control is no longer by medication. It's by the patient himself actually working on getting his blood pressure down through his diet and exercise. The other thing that I brought up that I put as a rationale is there are certain over-the-counter medicines that elevate our blood pressure. So the fact that we have high blood pressure, that plays an important role because that determines sometimes how the physician treats us in the medications that he gives us or recommends. They will recommend over-the-counter medicine, and there are some that they will not recommend because of the fact the patient has hypertension. Diabetes is another one. Chronic diseases trips us up a lot. How do we know what to code and when to code? Sometimes it's just a matter of policy for that specific physician. If you are focusing on the guidelines, which is what you have to do until a physician says we don't code certain diagnoses, then you're going to code based on these guidelines. This is what supports you as a coder for being accurate and complete. There are certain physicians that will tell you, I do not do history codes. So be prepared for certain policies and procedures that will affect different institutions, facilities for outpatient coding, physician for outpatient coding. I use another example here that I wanted us to look at. This is a 60-year-old female. She presents, she has a subcutaneous abscess. Her last visit was 1 week ago. Her symptoms include pain, swelling, tenderness, and drainage. The abscess is located in the left buttocks, and the patient's pain is described as sharp. She had a previous abscess that was treated with antibiotics. They will try those antibiotics again. However, if those antibiotics don't improve this abscess, the patient's going to need an IND. Patient has history of diabetes. And the physicians document just this way. Okay, this is taken from exactly what you're going to see in a physician. He says history of diabetes. All right, so the patient checks his blood pressure regularly. He's on Toprol for his blood pressure. Additional documentation says blood sugars are stable and controlled with metformin. No episodes of hypoglycemia, no side effects of meds, and he's compliant with his treatment. In the assessment piece on the physician form, the physician documents buttock abscess, diabetes mellitus well controlled, hypertension well controlled. His plan is to try antibiotics and then the IND if that doesn't work. Are we going to code the diabetes? Yes. Yes. What I want you to see here is that history of us. Don't let that trip you up. Because this is exactly how they word it a lot of times. That just what that physician is thinking is it is a condition that the patients had for a length of time. It's not that it's history of and it's resolved. And we know that because this patient's on metformin. If that patient didn't have diabetes, she wouldn't be on metformin. And if you have diabetes, it's not going to go away. So this right here, you're going to see a lot. And that is just the physician's thoughts. Hey, Annie Mae has had diabetes for years, so she has a history. That's their thought process. They are not coders. Blessing, do you have a question?
Yes, yes, Faye.
Okay.
Let me ask concerning the metformin. At this point, we can code for the metformin. That's putting Z90, Z79.8 something. Use of oral hypoglycemia drugs.
That is correct.
Okay.
Yes.
Thank you.
You're welcome, and thank you for the question. Yes, and when you go to diabetes, remember, do not assign a code without going into the tabular, because that is where your includes, your excludes, all your important informational notes are located. So when you go to code that diabetes, then you're going to have also code. So that's a good question. Thank you, Blessing, for bringing that up. So what I wanted you to see here is that you're going to see this. You're going to see history of. You may see history of hypertension. And that one may throw you for a loop, because that may be that the patient had an elevated blood pressure in the patient's past, but it's fine now. And there's no treatment. There's no other documentation. So let's just use that as an example. Let's say that this did say hypertension. Disregard this note right here. That's all it says, hypertension. And there's nothing here. Take this out. Whoops. Take this out. Take that sentence out. And all you have in your chart's a history of hypertension. Patient is not on any medication. There's nothing being done. Would you code it?
No.
Thank you. That's correct. Because it's not being treated. If we go back, chronic diseases treated on an ongoing basis may be coded and reported as many times as the patient receives treatment and care. So this is a guideline that you really want to make note of in your notebooks.